Alright, so this is going to be the upper extremity peripheral vascular exam. So first I'm going to do just a visual assessment starting from the axilla down to the fingertips. Just looking for any abnormal discolorations or like lumps or etc. Then I'm also going to do temperature bilaterally. So I'm going to use the back of my hands bilaterally. Start from up at the shoulders or axilla and down to the hands. And I'll have my patient put his arms out a little bit. And then I'll move into the nail compression test. So bilaterally, I'm going to squeeze the index fingernails and watch how they fade back, how the color fades. Then we'll move into the tissue turgor or the hydration status. So on the back of the hands, bilaterally, I'm going to pinch up the skin like that and see how fast it goes back to its normal position. And if it takes a long time, that could possibly mean dehydration. Then I'll check pulses at the ulnar, radial, and brachial arteries bilaterally. So I'm on the ulnar side, fingertips on the ulnar artery, feeling pulse. Then we go to the ulnar artery, feeling pulse. Then we're going to go to the brachial artery. And for brachial artery, we'll have him flex his bicep. Find bicep tendon, go just medial to it. And with the fingertips, feeling for the brachial artery pulse. And then from here, I would do that test bilaterally. But for this purpose, I will not. Then I'm going to check the epitrochlear lymph node. So this would be between the tricep and bicep, on the medial arm, between tricep and bicep, feeling for any abnormal sizes or tenderness with it. Then we'll go up to the axilla lymph nodes. We will go for the anterior first, which will be almost by the pec major, on the anterolateral, pec major. And then we're going to go to the lateral, which is more following the humerus, in the axilla, but following the humerus. Then the medial, which will be in the axilla, but on the thoracic cage. And then the posterior, which will be basically on the subscap back here, in the axilla on the subscap. And we're feeling those bilaterally as well, and we're feeling those for any abnormal sizes or tenderness. And that will do it for the upper extremity peripheral vascular exam.